genetic counselor, and in today's video I'm going to go over screening options that are available in pregnancy. I'll start by going over what's the point of screening, what kind of conditions can you test for, what are the different types of screens, who is this for, and what are the limitations. To get us started, I'll go over what's the point of screening. The intention behind screening is that you take a large group of people or items and you're trying to identify which people or items need further evaluation. An example of screening is airport security. You put your luggage through the X-ray machine, and for some people, their luggage is going to be flagged because it's believed that they may have prohibited items. Airport security then will physically check their luggage to see if those items are present or not. So the idea is that you screen lots of luggage by undergoing this X-ray or screening, and then only the ones that are believed to actually have prohibited items are the ones that undergo more evaluation. Likewise, in pregnancy, screening is able to identify those pregnancies that are at a higher chance of having certain genetic conditions, and for those cases, more evaluation can be offered and performed. What are the kinds of conditions that can be tested for? This is going to depend on the specific screen that's ordered for a person. Some conditions may include Down syndrome, trisomy 18, and trisomy 13. These are conditions where there's too much DNA. DNA is what tells our bodies how to grow and develop, so if we have any more or any less DNA, our bodies are going to grow and develop differently. This may be in the form of a heart defect or brain difference, or potentially intellectual disability. Other conditions that can be assessed include sex chromosomal differences like Turner syndrome or Klinefelter syndrome, as well as microdeletions. These are where little pieces of the DNA may be missing, which can cause health complications. There's one birth difference that can be evaluated as well called open neural tube defects. An example would be spina bifida. This is where there's an opening along the spine of a baby, and this opening likely will require surgery whether someone's still pregnant or after a baby is born. There may be mobility issues or other health complications related to this specific birth defect. What are the different types of screens that are available? There are two main types. So first would be the cell-free DNA screen, and the other would be multiple marker screens. Multiple marker screens have lots of different variations. In general, a multiple marker screen is going to be a blood draw that's performed at a specific time in pregnancy. Within the bloodstream, there are hormones being produced primarily by the placenta. And the lab that's doing the analysis is going to be able to determine the levels of those hormones and those patterns to be able to predict the chance for certain conditions. The first trimester multiple marker screen is called the first trimester screen. It is done between 10 weeks and 13 weeks and 6 days. There are two hormones that are being assessed with this screen, including the pregnancy-associated plasma protein A or PAP-A hormone. The second is the human chorionic gonadotropin or HCG hormone. This assessment can also integrate two ultrasound measurements, the first being the absence or presence of the nasal bone of the baby, as well as the nuchal translucency or NT measurement. The NT measurement is measuring the amount of fluid that's behind a baby's neck. There should be some, but not too much. So after analyzing the hormone levels, as well as these two ultrasound measurements, they can all be integrated together to provide the chance for Down syndrome and trisomy 18. There's also a second trimester version of multiple marker screening, typically referred to as the quad screen. There are 4 hormones being assessed with the quad screen. The HCG hormone, which is also being evaluated in the first trimester. There's inhibin A, estriol, and alpha-fetoprotein or AFP. This screen is evaluating for the chance of Down syndrome, trisomy 18, and open neural tube defects. There's also 2-part screens, so these are both a first trimester blood draw and second trimester blood draw. When the results are revealed to a patient will depend on the specific type of 2-part screen that they undergo. So there's the sequential screen, the combined screen, and the integrated screen as the primary 3 types of 2-part screens. The 2-part screens are also evaluating the chance for Down syndrome, trisomy 18, and neural tube defects, but typically the detection rates are going to be a little bit better than the quad screen. Lastly, there's the maternal serum screening, AFP, or MSAFP evaluation. This blood draw is looking at the AFP levels in a pregnant person's bloodstream to be able to provide the chance for open neural tube defects. This screen can be ordered if someone's already had the first trimester screen or if someone had the cell-free DNA screen, which I'll talk more about. The MSAFP is not generally ordered if someone's had a quad screen or a two-part screen, given these are already evaluating the AFP levels. Then you have the cell-free DNA screen bucket or option. Cell-free DNA screening can also be referred to as non-invasive prenatal testing or NIPT, or non-invasive prenatal screening or NIPS. This is also a blood draw that gets performed typically after 10 weeks of pregnancy and can be done at any point in pregnancy after that. Instead of looking at hormone levels, the cell-free DNA screen is evaluating DNA. The conditions that it's evaluating for, such as Down syndrome, trisomy 18, and trisomy 13, these are all conditions where there's too much DNA, and so the detection rate for cell-free DNA screening is generally greater than for multiple marker screening because it's actually assessing the underlying cause of these conditions. However, it is very important to check in with the lab that is performing the screen for their detection rates because the lab and the type of screen, all of these things may vary, so it's important to double check that. Who is this testing for? Per the American College of Obstetric and Gynecology, screening should be offered to all pregnant people. However, not every pregnant person needs to have this testing done. It is a personal decision. There are some people who go into pregnancy knowing that they'd like to have this information to then let them know whether they should pursue diagnostic testing. There's diagnostic testing options available while pregnant, and there is a video on that information that I'll link below, as well as the option to do testing of a baby after birth. Someone may use the results of diagnostic testing to inform them of what to expect for their baby after birth and help them prepare should their baby be diagnosed with a genetic condition, or they may use this information to choose options like adoption or termination. For some folks, while they might want to know the health of their baby, if anything, the results of these screens may just invoke anxiety, and they otherwise wouldn't do anything differently while they're pregnant. So for some people, they don't choose to do this screening and would otherwise just test their baby after birth should there be any reason to think their baby has a genetic condition at that point in time. Most babies are not born with genetic conditions. It's ultimately a very personal decision of whether or not someone pursues screening options. What are the limitations of screening? As you might imagine, there's quite a few different limitations. The one that I'll focus on here is the fact that screening is not considered diagnostic. If someone receives a positive result, they will need to pursue more testing, whether that's testing while they're still pregnant or after a baby is born in order to confirm or exclude the results. This also goes with a negative result. Some people can still pursue diagnostic testing even if their screen is considered negative, because a negative screen is saying that the chance of those conditions has been reduced but hasn't been eliminated. Lastly, screens are really narrow in their focus. They're only assessing for very few genetic conditions. They are not considered comprehensive for all genetic conditions, and so more evaluations and testing may be needed for a pregnancy or a baby after birth, given that screens are really just focusing on a couple different conditions. In summary, I covered the most known screening options that are out there. There are other ones out there as well. I also only did a really general overview about these screens. If you have more questions or want to talk about these screens in more detail, certainly check in with your providers as well as modernreproduction.org. And as always, I hope that you enjoyed today's video and I hope that you have a lovely day.